Hello everyone, today we are back with another video. So in this video we're gonna learn about how to do the wound assessment basically with drain tube. Well, I don't have drain tube at the moment, but I can show you how to do the wound assessment, how you should initiate the whole procedure, right? Alright, let's do it. I have a I have here a well, something like a mannequin that I have drawn in the cardboard, so it's kind of easier for me to demonstrate what I'm doing. So I will be out and I'll into the room. So I have made a script for myself as well, so that it's easier for me to follow through, right? So I, you know, I. So what's the one? Yes, this the one. So basically what we are doing here is we are actually removing the drain tube, and drain tube looks like a drainage where there is a, well, I don't have a drain tube, actual drain tube here. Well, it's on my uni, but I can tell you how to do it, right? So first of all, the most important thing is you need to have a doctor's order. Once you have the doctor's order that the doctor has said that there is a particular patient and you need to remove the drain tube of that patient, then you are you are sure that okay, I need to remove the drain tube, right? So once that's done, you need to do the patient identification. You're asking the name of the patient, date of birth, and also MRI number of the patient, which is on their wrist. So just ask for consent and check the wrist, right? Once that is done, ask for any allergies, because there are so many patients they are allergic to certain kind of dressing. There are so many patients that are allergic to maybe um, you know the gloves, the, the latex. So many patients are allergic to latex, so that's really important to know that. And tell your patient how to do deep breathing. It's like deep breathing exercise is important when you are doing when we are taking out the drain tube from their wound. It's important for them to calm them down, so that's why just ask for it, right? Once that is done, so ask for pain. So there are so many patients where they feel pain, and that is extremely important for you to ask and do the pain assessment, which is PQRST. And so P means provoke quality of the pain. Is it like a tingling, numbness, like what sort of pain that is, right? And once the quality is done, R being the rate of region of the pain, like where exactly is the pain? Is it located in one place? Is it moving from like one to another place, or what exactly happening with the pain, right? Once that is done, uh, severity. So 0 being the least and 10 being the highest, how do you rate your pain? Like what's the level of pain that the patient is currently feeling? Just ask that. And once that is done, ask for the timing, like does it like constant, it is like intermediate, it comes and goes, what exactly is the time that you started feeling the pain. And once you understand the whole identity of pain and you know the score of the pain, you move forward, right? So what exactly are we are doing is we are actually like getting the baseline of the patient, what exactly are their needs and what exactly they need. Like if someone is pain, we can't do the procedure, right? We have to give them medication. And once that's done, now we'll move into the whole procedure. Well, I'm explaining here, that's why it takes longer, but in real life it's really shorter, right? So you adjust the bed height, right? You adjust the bed height to draw the curtains and maintain dignity, privacy. And once that's done, you make sure that how many drains the patient have, and where exactly the drain is, where exactly the wound is. Once you identified, now bring your trolley. For example, my chair is my trolley for now, and I have actually opened the wound pack, but I'm gonna show you a wound pack as well, how does it looks like. So wound packs looks like this. This is the wound pack. Well, it has got a date on it as well. You have to check the date before taking it out. um, it looks like that. There is inside like some forceps, some cotton balls, and you can put saline on. You have a different saline, right? So I'm going the step by step procedure what exactly you have to do. So take out the, so once everything's done, right, do the hand hygiene, take this trolley out, clean the trolley with alcohol swab so that there isn't an infection or sign of contamination. So once that's done, what you have to move on is you have to take out all the stuff that you need. Like you are not running back and forth, right? Take all the stuff. Like what are the stuff you need? You need suture cutter to cut the suture. You need the one that I said, this one, wound pack. You need saline, you need hand sanitizer, you need sour bean container, you need extra gauze, you need the dressing pack, which is eyeline dressing, like putting the dressing on top of the wound, right? And once that is done, now you should start the procedure. So see, this is the whole thing that you have to do before getting into it. Now once that is done, you have to move into the main stuff, that is taking out the wound. Now to the donning of the PPE. Now wear the apron, wear the the gauze, and wear the gloves as well after doing the hand hygiene. Once that's done, take out the dressing pack, take it out, take it out. You can only touch the dressing pack. I can show you here if you are able to see. So it's a dressing pack right here, and then all the forceps part here. As you can see, these are the forceps, these are like the tongs, right? So as you can see here, and this is the main thing where we put the saline here, and these are the gauze, these are the cotton balls. So we dip it in here, and then we clean the wound. And after we cleaning the wound, we are making sure that we are not touching each other forceps. We are just using the one that is on the wound, and one goes on here. So that's ANTT, that means aseptic non-touch technique. That's important for everyone to understand, because that's what is the whole idea of making sure that there isn't any contamination in wounds, because that's exactly what the people need in hospitality. While you are giving exam, the educator that they will always emphasize on this topic. All right, now once that is done, you have to start the procedure. You set it up. Now you have to take out the dressing that is previously here, like for example, this is the wound, for example. So there is a dressing here, and you have to take it out, check the dressing, check the exudate level, what if there is any blood, if there is any, like what sort of color it is, like examine the dressing itself, and take it out and cut the clean the area of the wound, like clean it one time, throw it one time, throw it one time, just do it 3 times, just like using the one I showed you, the cotton balls. And there is a dry one, so use dry cotton to make it tap dry, just tap it dry. Now once the upper layer of skin, if there is any dirt or any kind of stuff like that's already removed, right? Now you have to move in the other procedure, that is you have to cut the suture. Now take out the suture cutter. There is like a knife, small knife, so take it, just cut it in half, pull it out using the forceps. And I'm just verbally saying it, but it's better if I show you, because I don't have the I don't have the stuff that is required to do that, so I'm just explaining whatever I can. You take it out, you throw the suture cutter in the sharp bin. That's yellow bin, that it only contains sharp things, right? And once that is done, your main process is done. Now you have to tell the patient to start doing the deep breathing, right? In count of 3, 2, 1, and pull out the whole drain tube out of the stomach, or where the drain is. And once it's out, you put the apply pressure by using the gauze, using one of the gauze, put apply pressure, because otherwise it can flow out, if there is any blood. And once that is done, you have to wait for like some time, and after that put the strip, which is like a dressing, and on top of it put a iron dressing, clean your all stuff, and you are clear. So that is it. How to drain it. This is a whole theoretical thing where I'm explaining everything. Well, I don't have, because I already said, because I don't have the stuff to do that, but I hope you got some ideas on how to do drain removal. And one more thing that I reckon I forgot is that you have to take out the vacuum before doing that, and also make sure that tell your patient to not go to the washroom or go wherever they want to go. Just ask them when you came in, like if you want to go to the washroom, you can go now, but after doing the procedure they can't move their body much, they can't stretch, because we just take out the drain tube. So just tell them you can move from your bed for half an hour, just stick to it, and if you want to go to the washroom, you can go maybe after half an hour, 1 hour, So yeah, that's it. I reckon it's very easy. And also record your how much the liquid was in the drainage on the FBC, which is like fluid balance chart, which is basically in progress note as well. And I think you will be fine. Thank you for watching my video. Peace out.